We've been talking about coronavirus threats for weeks now, but over the past 24 to 48 hours, there's been a significant shift in attitude as governments and organizations seem to be taking the spread of this virus a lot more seriously, including here in Massachusetts, where multiple reports indicate the Boston Marathon will be postponed until the fall. That comes a day after the NBA suspended its season indefinitely after a player for the Utah Jazz first tested positive last night, and now a second has as well. The NHL, Major League Baseball, Major League Soccer all followed suit today. The Marriott Boston Long Wharf Hotel, which hosted the Biogen conference responsible for more than three-quarters of the known cases in the Boston area, has shut down. One of the city's biggest annual events, Boston Comic-Con, was postponed. The Boston Symphony Orchestra is canceling all shows in Boston and Tanglewood for the next few weeks. Museums here are closing their doors. In New York, all Broadway productions will be shuttered for at least 4 weeks. And in D.C., the White House has suspended public tours. The U.S. Capitol has banned members of the public from entering through the end of March. And some members of Congress are shutting down their D.C. offices, as some states, like New York, California, and Oregon, are banning all large gatherings. And although I usually save my commentary for the end of this show, this one can't wait. Because while everything I just described demonstrates decisive action, the president failed that test last night.
This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. My administration is coordinating directly with communities with largest outbreaks, and we have issued guidance on school closures, social distancing, and reducing large gatherings. To ensure that working Americans impacted by the virus can stay home without fear of financial hardship, I will soon be taking emergency action, which is unprecedented, to provide financial relief.
A foreign virus, or as the top Republican in the House called it, a Chinese virus, xenophobic at best, racist at worst. Trump went on outlining promises of action with little detail except for this.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days.
The problem, that wasn't entirely true. The administration had to issue clarifications almost immediately after, saying the ban was only for non-U.S. citizens coming from certain countries. But today, things got even worse.
It goes away. It's going away. We want it to go away with very, very few deaths. People have, we call it cases. How many cases do you have? Well, relative to other countries, we have very few cases.
Last night's greatest failure was the denial of reality. To be clear, coronavirus is not going away anytime soon. We do not have tests for everyone who wants one. Joining me now are two men who don't have the luxury of playing loose with the facts. President and CEO of Tufts Medical Center, Dr. Michael Apkon. Doctor, it's great to have you here. Thank you. And President and CEO of Beth Israel Lahey Health, Dr. Kevin Tabb. Dr. Tabb, it's good to see you, too. The president said we have very few cases. In fact, 1,400 confirmed this today. Everybody knows that number is not close to reality. Do you feel you have your hands around the magnitude of this problem, Doctor?
I don't believe that we know the number of people that are actually infected. We know the number of people that have been confirmed to be infected by testing. We believe that there is more widespread coronavirus that we will only know when testing becomes more liberally applied.
Do you have a feel? I mean, I think virtually everybody would agree with that. Say maybe the president wouldn't, but would agree that obviously the number is far greater because of the lack of testing. But you have to be able to make predictions.
Yeah.
Are you able to or no?
Well, we certainly, we know, I think all of the medical professionals know that coronavirus is circulating widely in the community already, and we're seeing cases. And we also know the rate of infectivity, and we know that it's rising rapidly. So if we're anything like any other country that we have seen, there is no question, based on the number of cases that are positive, that that is the tip of the iceberg.
Can we talk about this testing thing you broached a couple of minutes ago? Obviously, there are two points of view. There is the president last Friday, and there's the director of the National Institute of Allergy and Infectious Diseases, Dr. Fauci, just today. Here they are.
Anybody that needs a test, that's the important thing. And the tests are all perfect. Like the letter was perfect. The transcription was perfect, right? This was not as perfect as that, but pretty good.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not. It is a failing. I mean, let's admit it.
How bad is the lack of testing?
So it's just a fact that tests have not been widely available in this country. That's an incontrovertible fact. They're coming online now, and we're seeing now the commercial labs making it available, although it's still not widely available. But it has not been widely available for anybody in this state or elsewhere.
You know, I got a bunch of emails from doctors today, a couple of whom actually work for you guys, who were saying almost the exact same thing. I have a patient comes in, I'm paraphrasing, has symptoms unless they've done international travel or have come in contact with somebody who has the coronavirus. I'm often not able to even test them. Is that true?
That is basically correct. The restrictions around who can be tested have been gradually relaxed, but they still require a very high probability that the person actually has the infection. And what needs to happen for control of the spread of the infection is to be able to screen people, to identify people that are carrying the infection with less significant symptoms.
So what do you do in a situation?
I would say, though, I think that the consternation about testing has been appropriate, but is rapidly going to be a moot point.
Why is that?
Because it was incredibly important a week ago or more to be testing out widely in the community to see where we were seeing the virus and to contain it. I think we've passed that point.
It's too late, you're saying.
I think it's still important to test, but I think it would be fair to say that in a week's time, the majority of patients that show up with or without a test that have respiratory symptoms and a fever, we can assume that it is likely that they have coronavirus.
So, by the way, the Globe reported, there were not many numbers on testing from the state of Massachusetts. The Globe reported today that the Baker administration has urged medical facilities, hospitals, not to report their testing numbers. Is that true?
I am not aware of that.
Is that, you don't know that?
I certainly had not heard that.
And have you reported your testing numbers?
Yes, we do.
You have, okay.
Yeah.
How ready are hospitals? I mean, we all know, it's fresh in everybody's minds, how ready all the hospitals were here not so long ago after the marathon. How ready are you for this today, Dr.
So
Tabb?
all of the hospitals that are part of Beth Israeli Health and every other hospital in this state have spent years thinking about and preparing for disasters, including pandemics. Mm-hmm. You know, I heard somebody say that no one could have imagined this would happen. That's not true. We all knew that this would happen at some point, and we've spent years preparing for it. It is very different to think about and prepare and to be faced with the reality of it, though.
Are you worried potentially about being swamped like we read Italian hospitals being swamped virtually every day now?
I think
Doctor?
that's the big fear. We're all prepared to care for patients with coronavirus. We're prepared to keep our staff safe. The biggest concern is that the need for critical care beds and ventilators will outstrip our ability.
What is the reality of those things? And when I read the numbers, the number of ventilators needed, the number of ICU beds that are needed, and you hear people like Dr. Sanjay Gupta every night on CNN, who's not exactly an alarmist, comparing the reality of the numbers with the potential need for the numbers, and it's frightening. Is there that level of potential disconnect?
The fact is that we don't know how significant the demand or the burden will be on the healthcare system, and it depends very much on how fast the pandemic spreads through the population, which will influence the number of people that are sick at any one point in time. The hope is that through the efforts that are being made in school closures and moving people away from each other in public, good hand hygiene and that kind of thing, that will slow the rise of cases to the point where the healthcare system can continue to operate effectively.
Are you worried, though, about that potential?
Yes.
Are you worried about it?
I am worried about it, and I also think that there are still things that we can do to mitigate that risk.
Like what?
The first thing that we can do is to take really seriously the fact that we need to reduce public gatherings to a minimum. And people are starting to do that. That should have happened some time ago, and it is happening in other countries. If you look at countries that have successfully dealt with this, countries like Singapore, you know, they took quick action.
But you know, you don't have to go to other countries, Doctor. There are other states or cities that have limited. I think Seattle, the number is no gatherings more than 250. San Francisco, no gatherings more than 1,000. Should Governor Baker, when he talked about what he's doing intra-government the other day, said we hope the private sector will follow suit, quote, where appropriate. No dictates. Should there have been directives from the governor saying there should not be, it's up to you, there should not be gatherings of more than X in these communities? Should we have heard that?
I would say that if I were the one in charge, I would probably ask for no gatherings above a certain amount.
And would you agree with him?
Well, I think these are difficult decisions to make. There's an economic impact for people that still have to pay mortgages and buy food.
Aren't we past that already, though?
Well, I think
I'm not belittling the consideration, but when virtually by the hour things are shutting down.
So I think that government and the public sector, the private sector needs to take as much precautions as is feasible given the community needs and the need to continue to operate transportation and healthcare and other sectors.
I would just say, you asked if we were worried, and I think we both said that we were. I want to differentiate, though, between being worried and being panicked, because I don't think that I've heard very many leaders in healthcare panicked, and that would not be helpful and isn't warranted. The difference between the two is you can be worried and you can take steps to mitigate the risk. And I think what we're all urging is that we take those steps so that we don't end up in a situation.
But if you're, then why are you hesitant to say that Governor Baker, and I think they've done a lot of good things, should just say, pick a number, 250, 500, whatever. Don't leave it up to the private sector. Don't leave it up to an entity worried about their bottom line, as horrible as it is that they're going to suffer economic consequences. So there is consistency across the board, and so that your job is made less difficult, no?
I think it's pretty clear that we need to restrict large gatherings. I would agree.
By the way, did the Tom Hanks, this is going to come out totally wrong when I say, let me be careful. When the Tom Hanks, Rita Wilson thing came, when they did that Instagram yesterday, that they were infected themselves and they're Australia. In many ways, I thought that was a good thing. Not that they were infected, that's the thing, but that people who are in denial, because people like the president is in denial, realize that if even the big boys and girls, the rich and famous, can get this, then people like me can too. That's a good thing in terms of public awareness, is it not?
I would agree. I think the more people can relate to what's happening and see themselves as a potential person that has the virus, the more government signals around closures and makes that clear that that's a beneficial strategy, the more comfortable people will be with all the actions that are being taken.
Can I make you both the czar of healthcare for a minute? So it's no longer advising. What should the president or this governor be doing that they're not doing? Again, would cause you to see a lot less pain in your facility. Start with you, Dr. Tabb.
I think that there need to be three things at least that need to occur. We need to protect a healthcare system that could be overwhelmed. We need to protect people who are most medically fragile and at highest risk. And we need to rapidly enforce social distancing and hand washing.
How do we do that first thing? What do they do to up your capacity?
I believe that at the federal level, they need to enact a state of emergency so that they can allow us to take quick action on a number of things that could only occur if a state of emergency occurs. Like the ability to open alternate facilities that you can't open in a...
Are you examining those already? I mean, I've heard a lot about convention centers are going to become hospitals. No? Yes? No?
All of us are examining them and looking at those possibilities.
Do you share that list with Dr. Tabb?
There's a lot of collaboration at the level of the people managing our incident command centers, at the level of the CEOs with government. The decisions about things like the command centers would be decisions that would be taken most likely by government and would involve all of us. And that level of collaboration, I do believe, is going on very actively and working well in this region.
Okay, let's bring it down to small level. If again, someone's sitting at home watching, they think they have symptoms, what do they do?
Well, I don't want to diagnose here. You need to speak with a physician. That does not mean that you necessarily need to run to the emergency room.
I don't have a physician. What do I do?
So if you then you are going to have to determine whether or not you have symptoms that are serious in nature, and if so, then you're going to need to either speak with a physician or see a physician. If you choose to go and see a physician, it is advised to let them know ahead of time that you're coming and that you have symptoms that could be indicative of a coronavirus, and not to just show up and potentially infect the healthcare workers.
Dr. Apkon, what's your final message for an anxious, confused family sitting at home?
I think people should take the guidance that's coming from government seriously. They should take as much precautions as they can around social distancing, and they should take every precaution from the standpoint of good hand hygiene and good cold hygiene if they're symptomatic or if they're around people that are symptomatic.
Do you, well, 30 seconds left. Do you think that when we get out of this, that the ability to deal with the traditional flu that you guys probably are frustrated about us not dealing with in a credible way, what is it, 25 to 60,000 people a year?
Yeah.
Are we going to be in a better place around that?
I do think so. I think that people will be more willing to consider vaccines, and I think that people will be more willing to do things that have a significant effect, like washing their hands, where we know that that can reduce flu by as much as 40 or 50%.
I'm one of those people. Dr. Tabb, Dr. Apkon, thanks so much for your time. Appreciate
Thank you.
it, gentlemen.